Over to you, sir.
Thank you, sir. At the outset, let me thank Rotary Club, Athashri, and in particular, Shri Raja, for making me share some of the observations on yoga to motivate all of us to practice yoga. Let me make a declaration that I am not a yogi. I'm only a researcher in the field of yoga, though I practice yoga, but I can't claim the authority that several of the yoga gurus have in this field of yoga. In fact, they started popularizing yoga, but whereas I'm just researching on yoga. Nonetheless, my humble submission to all the audience is the attempt in this maybe 20-25 minutes. I don't know how long I given time to speak. Maybe I will not take more than 25 to 30 minutes and let some questions be available for you to ask. To impress upon you what is the science behind yoga. In some areas, if not in all areas, mental health in particular, even in mental health, a small part of the mental health where science we have been able to demonstrate. There are many other areas in mental health and in health itself. Yoga has been extensively researched today, and we have a lot of data, but I am just showing one facet of it to bring it to your attention. So I will be using some slides during my presentation. Hopefully that should be possible.
1 second. Mr. Raja?
Yeah.
You need to make Dr. Gangadhar a co-host. Okay. Dr. Gangadhar, now you can share screen.
Yes, sir.
Thank you.
Hopefully you're seeing some slides on the screen.
Not yet. Have you shared screen, sir?
Let me see why it did not. I've gone to slide share. Slide share. Yeah. Share. Does it work now?
Yes.
Yeah. Yes.
Perfect. Thank you.
Yeah, there it is. Okay. Yoga has come to stay with all of us in our day-to-day life as a lifestyle measure, thanks to the Honorable Prime Minister who alluded to yoga in his first talk in the United Nations meeting, where yoga got a place. And in fact, it is said that it was one of the resolutions which was passed with the highest number of votaries and also with the shortest time from the time the move was made and the resolution became accepted. And from 21st June of 2015, International Day of Yoga has been announced, and we have been practicing yoga. One of the corner pictures is the first Yoga Day meeting, which was chaired by the Honorable PM, and in the Rajpath in New Delhi, close to over 50,000 people practiced yoga together. And of course, all countries practiced yoga in some or other forum at the same time of the day, 7 o'clock. And that is going on year after year. And we recently also held it the 6th year's celebrations, although in a homebound manner. Because of the COVID, we couldn't come in masses like this on the streets or fields to do yoga. Yoga has now become a very popular event world over, and it has brought people together. And in fact, yoga is said to be something that unites. Samyoga yoga ityukto jivatma paramatmana. Yoga connects my personal consciousness to that cosmic consciousness if practiced well. That transcendence is what we see in one or other forum today. It can connect my personal consciousness to the cosmic consciousness, surely it will connect my personal consciousness to the neighboring consciousness, and we start coming together and together on the same platform. Like this happens in this June 21st, when large people come to the streets, the fields to do mass yoga drill. The yoga has actually connected people, connected nations, connected communities, connected all age groups, and people have been practicing yoga. And in fact, this connectedness is a message which I got from a teenager. This was about close to 10 years ago. A teenager engineering student, a daughter of one of my classmates, happened to talk to me. I made a visit to their house and I saw photographs of Shri Ravi Shankar, Sadhguru, Baba Ramdev, various yogas, postures on the living room. I wondered when did my friend turn to yogi activity. And I asked him what happened. He said, my daughter is deeply into yoga and she has put this. So the daughter, 19 years, engineering student, teenager, how can she be attracted to yoga? Teenagers are attracted to a lot more things today. Why yoga? And then she came out of the room where she was studying and said, no, uncle, I have been very keenly following yoga. Yoga I'm practicing and so on. So asked her, can you tell me one experience that made you get attracted to yoga? And she said very interestingly, I feel connected. Connected means what? No, I feel connected with my family members. I feel connected with my yoga mates who are doing yoga along with me in that yoga school. I feel connected with my classmates. When I come out, I feel connected with all my neighbors, all the people I see around. I'm not alone, it gives me that confidence. I feel a feeling of well-being that I have people with me. Vasudhaiva Kutumbakam. The whole world is connected. Oh, I thought for a while this was either a Baba Ramdev or Shri Ravi Shankar speaking. No, it was a teenager. From then on, I also got attracted to this connectedness, and we have done some research on this neurobiology of connectedness and yoga, although I'm not alluding to that here. The fact remains that a feeling of well-being is something that yoga generates, and so people have been practicing and has become very popular. And yoga also has kindled interest in researchers, and more people are conducting research today. And exponentially, the numbers of research articles in scientific journals on yoga have been increasing in the last 20 years. And of course, we too have contributed to a little close to about 100 scientific publications from NIMHANS alone ever since we started the yoga research in clinical population about 10 to 12 years ago. So yoga has attracted public, attracted researchers, and yoga has been growing. And today what I will be speaking to you is a very brief evidence support from the angle which I have studied. As I told in the beginning, I'm not a yogi, I'm not an authority on yoga. I cannot bring in that authoritative experience of mine to tell others, you do practice yoga. But what I can do is I can bring in the evidence that is required for a scientist to be advocating yoga or a doctor to be advocating yoga to his patients or the public. So there is a small facet of yoga evidence research that we have been able to demonstrate. There are many other things others have demonstrated, and we have also demonstrated many other evidences for yoga. But suffice to say that I will take a small facet of it to illustrate in front of you how yoga can be helpful to an individual to feel well, get over his depression or her depression, and what is the neuroscience behind its function as a anti-stress or anti-depressive intervention into individuals. So here I am, neuroscience of yoga, some evidence for motivating us to practice yoga. Why did it attract mental health professionals? In fact, more research has come in yoga by people from mental health professionals than from other physicians, though. Ever since yoga was introduced into the public in general, yoga and mental health have been an inseparable ingredients. And in fact, Yoga Vasishta, the very first document in Ramayana where yoga has been alluded to, says manah prashavanopayaha iti yoga. what makes my mind very peaceful and strong is yoga. And the same thing, Yogacharya Krishna also says, Samatvam Yoga Uchyate. As you know, Yogacharya Krishna is the first one whom we can recognize as a formal psychotherapist, a person who counseled Arjuna in the battlefield and made him go back to the warring field. Samatvam Yoga Uchyate. There are many other yoga issues that are talked about in the entire Bhagavad Gita. Suffice to say that one of these quotes this is very popular to me because we use it in our NIMHANS logo. Equanimity is yoga. And more recently, Patanjali, the sage who introduced yoga to the public as a good manual of Ashtanga Yoga, who also says in his very second aphorism, Yoga Chitta Vritti Nirodha. What helps in reducing the oscillations of my mind is yoga. So yoga and mind or mental health is something that has remained inseparable. And we know that mind is the seat of all stress or relief. So if my mind is very stressed and I can translate that into other bodily parts and get myself becoming ill. So the mind is the source of Adi. Adi is the one where mental distress is the root cause. The Adi ja Vyadhi. This Adi, when it goes on, can lead to Vyadhi. Many of the lifestyle disorders have a root cause from Adi. The mind being unstable, mind being disturbed, leads to many bodily symptoms at some point of time. And of course, it can also lead to mental illness, although that classification of mental illness and physical illness has not been so well made in this slide. But nevertheless, mind being peaceful has a good chance of being keeping me away from that vyadhi. And so disturbed mind has been the root cause of the disease. And so Charaka Samhita and many other yoga texts also say that the vyadhi, the roots are in that adi. Adi is the mind which can potentially become disturbed to lead to that vyadhi. And so the common stress-related disorders in day-to-day living originate from this Adi, which is supposed to be linked to this Manomaya Kosha of the Panchakosha theory of yoga diagnosis. So the Manas, which is disturbed, can lead to various implications on the body, and then it can go on to weaken my other koshas, leading to entirely to become a person ill, both physically or mentally. So even in Gita, the Lord says it is the mind which eventually moves on to make my body quite deranged. It says the desire, the Vishayan, which is what they call as desire, for which we get attached, infatuated, and then we go on to develop kama, the infatuation, great need for the desire to be achieved. And when I don't get it, I become angry, and then I become disturbed. I lose my mental state and mental illness, and the mental illness would finally lead to pranashyati. This thing is a very good shloka in the Bhagavad Gita, which says how a disturbed mind state, which can be generated because of my poor handling of my own mind, and which could eventually, in a stage by stage, take me to a lowest nadir of my life. So, yoga, as I mentioned, somebody said it keeps me connected. A lot of people say that I feel very balanced, I feel very calm, my sleep is better, I'm not very angry, I'm able to concentrate better. I'm sure if you Google what are all the benefits of yoga, you have many of these things stated: connectedness, feeling relaxed, feeling calm, able to live without sleepless nights, eat better. These are all the top 10 benefits of yoga which people have talked about. I'm sure you too would have read this here and there. But what I want to demonstrate is, would it simply correct the mind, or would yoga also bring about various pathobiological effects, correcting them in the process? And so the net result is, does it bring a cure? Although the word cure may appear very radical, I just want to demonstrate that in one condition like depression, the pathobiology of depression, how yoga corrects. The same issue can get repeated in other conditions, ill, mentally ill or not, physically ill or not, or overall well-being. All these process changes that happen because of yoga could be related. So here I am to take the example of depression. Depression, because it's one of the common conditions which you may all encounter day in and day out. People keep showing suicide, depression in celebrities, and why depression cannot be controlled. And some of the celebrities who are affected with depression, how they fought and how they became victorious. Depression is a popular discussion that happens in media and in various other forums. So we thought of examining yoga in depression and its biology. This is what I'm going to illustrate to bring in the evidences that we have been able to garner. I'm not requesting, I'm also not making a theoretical lecture to you or very scientific and technical lecture to you, but just some illustrations in the researchers that have shown the yoga effects and the neurobiology of yoga. Depression, there is what is called as a meta-analysis. People look at all depression studies with yoga and how the other comparator was there. And in this slide, you can see the black dot is to the left of the midline, left of the line, which means that yoga is better than usual treatment, better than exercise, better than maybe even relaxation exercises what they're giving. So yoga in effect is helpful in relieving depression. I'm not going into the review of yoga in depression. There are so many studies. We also did a study which is not a strictly comparison study, although there is a graph comparing drug with yoga and yoga alone. The graph shows that the yoga people achieved lowest depression scores over the course of their treatment and compared to the drug alone group. But I want you to be cautious in interpreting this slide. Yoga gets depression scores reduced remarkably. I don't want you to compare it with the drugs in this slide because this was not a randomized clinical trial as in science says. But suffice to say, yoga practicing depressive individuals lose their scores on depression. Now we will go to the various biological processes that yoga will probably contribute to in making these people better. For example, in depressed individuals, it is shown that deeper structures of the brain are actually more active, and in the process, the outer structures of the brain become less active. So whether which one is the cause or which one is the effect is not something, a discussion point right now. The deeper structures become very active, leading in turn to the outer structures of the gray matter become less active. And this has been associated with many people with depression, particularly so those who have had a chronic depression. So it is said that there is a biological basis for generating depression. And so what can we do? One of the deeper structures of the brain is the limbic system. The yellow spots, what we are seeing in the left side in the screen, in the brain scan, are the points where the individuals will be hyperactive when there is depression. And this is a study where we made people chant Om, and when the brain images were recorded in a very sophisticated procedure called as functional magnetic resonance imaging. When Om is chanted, the yellow spots indicate that the brain became hypoactive or deactivated. So in other words, one of the components of yoga practice, chanting Om, can actually deactivate some of the centers, which potentially can lead to depression if they were hyperactive, if they were increasingly active. Although this is not a data from patients of depression, but we have some indirect evidence that this could well be happening in depressives who are practicing yoga, and no yoga practice is free from at least one session of chanting Om for maybe 5 minutes or 3 minutes. There could be other procedures of yoga which could also be bringing the same effect, although we have not still investigated to that effect, or for that matter, anyone else has investigated it either. The deactivation of the deeper limbic structures can actually make the individual produce more neurotransmitter called as gamma aminobutyric acid. This neurotransmitter actually inhibits the rest of the brain overall, so that I am not highly active. I am not thrown out of balance with so many thoughts, so many emotions, so many concerns pervading my mind and brain. So this gamma aminobutyric acid in depression is lower, whether in men or women, compared to healthy subjects who are otherwise are not predisposed to this distress or depression. So this is well demonstrated, and we looked at whether the GABA levels are changed following yoga practice. In fact, one of the researchers in New York has been able to demonstrate this in depressed individuals. The levels of the GABA, gamma aminobutyric acid, in live subjects can be measured today thanks to the technology that has been introduced, what is called as magnetic resonance spectroscopy. As you can see there, the GABA levels are indicated by a peak, which has been recorded before and after yoga in people who have been diagnosed as depression, and yoga has been prescribed in them. So before, the signal was slightly shorter. With the post-treatment with yoga, the signal indicating that the GABA activity or the GABA itself rose in the brain in these individuals. We did not try this method, but we used a very sensitive neurophysiological test, what is called as cortical silent period, CSP we call it. An individual who keeps his hand fisted, and we record the muscle potentials from his thumb. When the muscle potential will be very high and will be shown as those spikes on the left side of the graph here. And you actually stimulate the brain by putting a small cortical stimulation, transcranial cortical stimulation by a magnetic pulse, which actually makes this muscle, which we already kept it tight fisted, and it actually throws one more spike in the muscle. The muscle potentials suddenly have a burst of potential. After that, for some time to come, the muscle becomes very silent. This is because in the brain there is an activity related to GABA, which makes the muscle refractory to any other activity for some time to come, and anywhere between 100 to 200 milliseconds, the electrical activity in my thumb becomes flat. And this is called as the cortical inhibitory, cortical silent period. And this is about before and after yoga, we were able to examine them. In before yoga, it was anywhere up to about 50 to 60 milliseconds, and following yoga, it went to almost 110 seconds of cortical silent period, indicating in healthy individuals, yoga actually increased the length of the cortical silent period, which is a indirect measure of increasing of GABA that the yoga has produced. And we looked at individuals of depression. In depression, as you can see here, the pink graph bar on the left extreme compared to healthy subjects on the other extreme. These people had a very short the cortical silent period. And in this group of depressives, we distributed them into those who practiced yoga and those who practiced merely a walking as an intervention. The two light and dark green bars are those who did only walking. The cortical silent period did not greatly increase in these two groups, before and after, in this group. Whereas in the group of yoga, before to after, the cortical silent period lengthened. And very recently, we have repeated this experiment in a totally different population of a little more severely depressed individuals and who received longer periods of yoga therapy. And in them too, we were able to demonstrate that this cortical silent period, which is a reflection of the GABA tone in the brain, gets longer following practice of yoga. And yoga and exercise brought down the depression levels. But I want to make a comment here or a statement. Yoga not only brought down the depression scores, but also corrected the underlying pathophysiological mechanisms into this depression by enhancing the GABAergic activity, which we did not see in the group which practiced exercise. We recently published this as well in a very important journal. So an individual is depressed, distressed, and he is quite hyperactivated because the GABA is less in the brain. And in these individuals, we know that the levels of cortisol increases. Cortisol is known to be a stress hormone, and in depression, the levels of cortisol are higher than in individuals who did not have depression. And we gave yoga to individuals who were depressed, and we treated them, and we also gave them either medicines alone or medicines with yoga. When you give yoga, more individuals actually lost the levels of cortisol. The high levels of cortisol became lower in more subjects. Close to about half the subjects lost the levels of cortisol compared to medicines alone. Although I don't want to do a comparative study, this is not a randomized trial, but suffice to say, 2/3 of patients who had depression actually lost the levels of cortisol in their brain. And the levels of cortisol coming down has many other benefits. I will be coming to that later. But in individuals who have been continuously depressed and stressed, brain repair mechanisms actually suffer. And in these people, the brain repairing material called as the brain-derived neurotropic factor is actually lower in depressed individuals compared to individuals who have come out of depression or in those who don't have depression, healthy subjects. So individuals with depression have low levels of brain-derived neurotropic factor. The detailed explanation for this graph is quite statistical, but the take-home message is, in depressed, the brain-derived neurotropic factor, which helps to repair my brain from time to time, from day to day with wear and tear, the levels of this brain-derived neurotropic factor is lower in depression than compared to healthy subjects. And for that matter, a depressed having been treated actually gets this brain-derived neurotropic factors higher. Here is a graph which shows the two blue graphs on the left column is patients with depression and healthy subjects. Depression people had lower levels of the brain-derived neurotropic factor. You treat them and their levels of brain-derived neurotropic factor start increasing, inching towards the healthy subjects' values. And you give yoga, in fact, yoga pushes this quite more robustly. This is on the left column, the group is yoga or no yoga or medicines alone, whatever it is. There's a large heterogeneous group of people whom we treated and they got better. In them, depression getting better, BDNF actually rose. Treatment with yoga alone gives this benefit as well or even better. This is the message in this slide. Yoga actually produces brain repair mechanism by increasing the brain-derived neurotropic factor better. In fact, this improvement in the brain-derived neurotropic factor did not happen if these people did not get better with depression or the people continue to remain quite stressed. As you can see, that red line is the pre to post change in the brain-derived neurotropic factor. It did not change. In fact, it got even lower. This is the group of people where the cortisol levels did not drop following yoga. Whereas in the other group where the cortisol levels dropped, their levels of brain-derived neurotropic factor actually increased. This is very interesting to say, I want you to note that continued brain repair mechanism having faulted, the gray matter in the brain starts shrinking. This is a scan of depressed subjects. The red places are the places where they had lesser cortical gray matter compared to healthy subjects. And this indicates one of the popular Subhashita shloka, which says, Chita dahati nirjivam, chinta dahati jivanam. I am on a fire while I am alive if I am continue to remain depressed. I still keep losing my own self. So, chita dahati nirjivam, chinta dahati jivanam. So, depressed individuals fail to repair their own selves and then they start losing some important places in the body. Brain is an example. And you do yoga, the brain repair mechanism actually gets better. I said the BDNF levels get better in depressed individuals, and even in healthy individuals, the repair mechanism indirectly gets better. These are the scans which are a subtraction of the pre and a 6 month later post scans. And the yellow spot that I have shown here, which I have circled to draw your attention to, there's a small yellow speck. This is a place what we call as the hippocampus gray matter. This hippocampal gray matter actually, this is the group of elderly subjects, 7 senior citizens, average age of them was 70 years. They practiced yoga for a period of 6 months. We were lucky enough that they were obliged to get the scan done before and after. Today we have very sophisticated algorithms. We can look at the difference in the two scans and estimate how much of gray matter has increased or has been lost. And we measured in hippocampus because that is the place where the first loss of gray matter will happen with age or with any other illness. So that is the most sensitive area of our brain. We start decaying with when we are aged, and that's also an area where memory is stored. So hippocampal protection happened following a 6 month of practice of yoga in elderly subjects. Yes, the sample size was very small. Elsewhere, somebody has also demonstrated that with age, all of us have a smaller gray matter. That interrupted line slope shows healthy subjects, but they were not practicing yoga. Age-related drop in the levels of cortical gray matter happens. But if the same examination was made in yoga practitioners who had been practicing yoga for decades, in them that age-dependent drop in the cortical gray matter did not happen. So, in other words, there is some indirect evidence to say that in these yoga practitioners, there was some protection to decaying of the brain from practice of yoga. So here we are, the neuroscience of depression, which is what I have used to demonstrate the neuroscience of yoga. We have in depression increased activity of some of the deeper structures of my brain, which leads to decreased of the GABA, gamma-aminobutyric acid, and this in turn is related to increased levels of the stress hormone cortisol, which we have some data to show has an inverse relationship to brain-derived neurotropic factor or the repair mechanisms. The repairing mechanisms lead to cortical thinning, and this in turn leads to the decreased frontal activity, which leads to the increases of the deeper structures. A vicious cycle goes on and on and on. And you practice yoga at all these sites, there is some intervention that yoga makes to make the individual shift from a diseased state to a well state. So here we have some evidence for yoga making us actually feel better mentally. And that's the reason why I am advocating that all of us should practice yoga so that we are mentally strong and we also become more resilient. We are less susceptible to stress. And because we are less susceptible to stress, stress-induced other what we call as non-communicable diseases can also be mitigated by practice of yoga. Although all these things are, I'm generalizing from some observations, but suffice to say that if the yogacharyas or modern yoga gurus, Shri Ravi Shankar or Sadhguru or Baba Ramdev and a host of them can speak from the authority of their practice of yoga, and their knowledge of yoga. Whereas I don't have that authority to be advocating yoga, but the research data, what I have been able to generate, has been able to let all of us talk about yoga, and that mana prashamanopayaha iti yoga, what makes my mind strong and free from illnesses, gives me peace, is yoga. What has been said 5 millennia ago, we seem to have found some support in our scientific tools. And this work, what I have shared with you, has been a summated work of many investigators, many researchers who have worked with me in this area in our yoga center. And yoga center has also been providing free yoga sessions during the COVID period. These are the timings, 7 a.m. and 4:30 p.m. This slide, you can take a snap and keep it with you. These are the Zoom meeting login IDs. You can log in at the tower, and you can also practice yoga, which is a live teaching. It is not a video thing that has been put at these 2 hours. It's a live teaching by very senior yoga teachers who are with us. Both of them have been technically trained with masters and even PhD degree in yoga. One of them is even a medical doctor who can come on some of the days. But these are the addresses which those of you who want to use it can take a snapshot and then keep it and then log on for the yoga sessions. And we, of course, have put many of the YouTube material on the YouTube for yoga in the period of COVID, to build more resilience and more de-stressing experience for themselves. And in fact, what we have been doing, these tele-yoga services, we also have done some impact evaluation, and in 75 people who practiced yoga weekly for a period of 3 months, we found that they obtained about 15 to 20% reduction in their stress levels, even as small as about 40 minutes a day, once a week, and that too consistent training, they were able to obtain this benefit. So we have now made this yoga become available to masses for practicing it. And as part of our academic activity, we are also conducting a conference called as Yantra, which is the yoga and neuroscience with the traditional approaches of different nature, how to bring them all on common platform. I'm sure you can visit the website, and those of you who may be interested may also join, or also motivate any other scientists to join this conference, which is going to be happening in the month of October. So I thank the Atashri and the group of Rotary Club for letting me come over. And this is my email. Any questions are there, you want to email me. Any other feedback that you want to give, please go ahead and email on this address. So I thank you. I'm going to come out of the slide screen back to the screen where I can see all of you. All the best.
Thank you very much, sir. Many thanks indeed. May we have a few questions put to you? Yeah. Bharat?
Yeah, Mr. Raja, so I'm going to request people to unmute themselves if they want to ask a question.
Yes.
Otherwise, please leave your microphones muted, because more than 5 or 6 microphones are on, it's too chaotic. You can now unmute yourselves if you need to ask a question.
Yeah, if you need to ask a question, please unmute yourself.
Yeah, me, Rama, wanting to say something.
Yes,
Yeah,
madam.
go ahead.
Okay, this is regarding Om chanting that you mentioned, sir. I would like to add here that we have seen, Athishrians have seen the benefit of it, because we've been doing Om chanting every evening, about 21 times in a matter of, say, 5.5 minutes. And every one of us could feel the change in our system. And it benefited a person who was in severe dementia. I mean, almost everyone started commenting, maybe her medicines also, but everyone started commenting about how this patient was, becoming a little more aware. Then we had one severe cancer patient who felt that our chanting Om helped her forget her pain. And my own personal listing of my husband, who was a severe dementia patient, every time he became a little restless, violent, all that I would do was, just start saying Om to him. And it did help him calm down quite a bit. Thank you, sir.
Thank you, madam.
We in childhood learned Chinta Chita Saman. And Chinta has to be removed from our minds. So that is very convincingly told us how to pull out of depressions with the help of yoga. Now, the question I ask you is, besides pranayam, in pranayam, I chant yoga also. Are there any particular asanas that you recommend for depression?
Sir, although I may not go into all those micro details, the asanas and the yoga module that we apply for individuals who have depression is in public domain. It is available in our website, some scientific articles which we have published, also available in public domain, carry an appendix of what are the yoga asanas that we practice. And I'm sure you could visit our website at NIMHANS, NIMHANS Integrated Center for Yoga, which is you hit NIMHANS and you get all these articles. And the details are available. All the modules of yoga that we advocate.
Thank you, sir. Sorry for interrupting. Is
No
there any time frame for chanting yoga? 5 minutes, 10 minutes at a time, or 15 minutes? How much time do we, like we inhale and exhale Om? So like the lady just said, they do 21 times in about 5.5 minutes. So
yeah, there are different. Yeah, the entire chanting of Om, although there is no one rule which applies to all schools, many people say that the inhalation should be shorter than the exhalation. Usually in the frequency of 1:2. And you give more emphasis on that last consonant which will give you a sense of vibration experiences around your ears. And in fact, we have also a logic why this vibration experiences around the ear is relevant to the neurophysiology of Om. I'm not going to that part of it, but inhalation should be shorter than the exhalation, or the exhalation should be longer than the inhalation. I am making you emphasize on that component so that you get the feeling of vibration around your ears, on which you have to focus.
thank you, sir. Thank you very much.
Any others?
Yes, I'll ask. Yeah, so first of all, thank you, sir. Thank you for this wonderful informative session. And it was really packed with wonderful data study. And so we have actually another dimension where we could say how yoga is useful. So my question to you is regarding the Om chanting. Do we have some data to back that if we start the Om chanting very early age, has it some kind of effect on the brain development?
Theoretically, it should have, but if you ask me, are there any studies where people have looked at Om chanting done from young age, and those who have not done from young age, at the age of 10 years and 12 years, are there any differences in their body, mind, brain, and whatever it is? Unfortunately, we have not done that research. But it's true that we take all traditional texts and all our elders' words very seriously, and we simply practice without questioning. And today, science wants us to question, so we are questioning.
All right. Thank you, sir.
A question. Can I ask?
Any others?
Yeah, can I ask a question?
Sir.
I just want to know how does yoga help in reducing memory loss? Can memory loss be quantified, measured, and shown like what you showed in other cases? Does it have any direct impact? Yeah.
You are right, sir. The memory tests have been done before and after yoga practice for several months to weeks and years. People have done those tests. There are many data which is available. The memory functions get better particularly in the older group of people who don't have dementia though. Whether once the dementia sets in, whether yoga works or not, has not been very extensively studied. But those who have had what we may call mild cognitive impairment, early memory loss, which happens in many of us with age, this has a potential to be corrected or improved by practice of yoga. There is research data to that effect. And memory is measurable. And this is precisely, although I did not show those slides, the work that we have done, memory and cognition, many of these data on which yoga actually produces improvements have been fairly extensively demonstrated.
Yeah, my question relates to mild cognitive impairment. How does that help, or is it same thing like dementia? It won't help.
Yeah, mild cognitive impairment is a fairly amorphous and a large group of conditions wherein a person experiences subjective memory loss. In good number of them, memory tests could well be normal. A proportion of the individuals who are experiencing this mild cognitive impairment have the risk of progressing into dementia. Who amongst this group will progress into dementia is not very strongly elucidated. There's no definitive answer to this. But the fact remains, mild cognitive impairment people will obtain improvements in memory following practice of yoga.
Sir, I have a question on the chanting of Om.
Sir.
Some institutions say that Aum is to be pronounced as A-U-M, Aum, whereas some say as Om. Now, what at the Institute of Naturopathy and Yogic Sciences in Bangalore,
sir,
what they teach is starting from Nabhi, Hrita, Kantha, Rasana, right from the navel.
Like I mentioned to you, different traditions, the different ways of practicing of Om or any other yoga for that matter have been described. We are only beginning to unravel differences between each of those practices. We have only begun, sir. I must admit that I don't have answers to all different practices of yoga, whether it works or whether it produces the same effect or not, and so on and so forth. But the fact remains that whatever I have demonstrated works. I'm not saying that others don't work, others could well be happening. I have to do more research, and I must humbly admit that my research question has had a very small spectrum of exposure.
So there is a patient, in a very close friend of mine, who was excellent until about 4 months back. Suddenly he has hit a streak of depression, and I was interested in your lecture today mainly for the purpose of approaching you for his sake. I live in Chennai. We live in Chennai, and how do we approach?
Yeah, he can contact me, sir. He can send a mail. I've given
Yes.
the mail address. I'll be able to bring in some help.
That will be wonderful. We'll make a beginning with that. Thank you very much, sir. Thank you very much for your wonderful talk.
Thank you very much, sir. Okay, Raja ji, I think we should break. It's been more than an hour since we have been logging.
Oh yeah. Just 1 second, sir. Manoj.
Yes, sir.
Can I ask one question?
Manoj.
Yeah, you can go ahead.
Okay. You go ahead. Yeah, with your. Because
I'd like to ask one question too.
Yeah. May I take one more question? The last question.
I have no problem, but I thought a weekend day is more precious to all of you. Close.
No, it's been a pleasure. It's been a pleasure to listen to you.
What are the benefits of meditation? Can you enumerate, except calming mind? Are there any other benefits of meditation?
What more do you want?
No, madam. Yeah. I being a psychiatrist, I can only talk about mind. But as physicians, people have demonstrated many other benefits of yoga, starting from being flexible, lesser incidences of falls that happen in elderly people. They suddenly fall for some unknown reasons. Yoga gets them better. Hyperactivity in children gets them better. Their craving for drugs and alcohol, people have demonstrated that gets better. Their threshold to pain increases. They can tolerate pain better than what they used to happen in the past. And their immune systems get better. Each of these have been demonstrated by different researchers in different parts of the world and different parts of the country, different laboratories. So like I said, what you saw is only the tip of the iceberg, madam. There are a lot more research data that has emerged from yoga research world over. And what I may have used only the tip of the iceberg to illustrate one facet of yoga.
Can I ask one question?
Madam.
I'm Ranjini Kamath and I'm an Athashriyan. And as my friend Rama just told you, we were practicing Om chanting. And this was a very beautiful session, bringing us all together and afterwards having a little bit of chit chat. Now, recently, we have been told that Om chanting could also disperse, for COVID. It's better not to do Om chanting because this also could be dispersing, these particles that, what would your advice be? Because that Om chanting was a very beautiful period.
Please go
we
ahead
all
and do it.
get together.
As long as you are doing it alone in a group, in yourself. In any case, if you are meeting in groups, you ought not to meet at all. There is a ban on group meetings. That's the reason why I have met all of you on this webinar. Otherwise, I would have been speaking to all the 50 of you in a hall. You are not to be meeting in a hall. Whether you chant Om or you talk to each other or you whisper, you ought not to be meeting in halls. At home, please go ahead and say Om.
So we were not meeting at home. We were meeting
what
out
I'm saying is
and
you are
maintaining a social
at
distance
home.
also.
Please continue to say Om.
Okay.
Not in a group, but not in a group. Isn't
Even
group
if it's
Om
out in the
chanting more
open?
powerful?
In the groups, you should not meet at all, madam.
Oh, outside too, in the open air?
Hey, please go ahead and do it. Please do it all by yourself in your puja room or your room or in the terrace or whatever you want to do it.
Right. Not for the time being. Doing this, yeah.
Thank you.
Okay, Manoj. Now we'll get back to the Rotary protocols.
So I would like to take this opportunity, Dr. Gangadhar, to sincerely thank you, express a sense of gratitude to you for an excellent talk, I would say. That is neurobiology of yoga. I think that's something which was wonderful. I think you talked about limbic deactivation related to Om chanting. That was new for me. I did know that Om chanting is good, but the connection related to limbic deactivation, the connection to amygdala, I mean, all these were only thought or maybe read things, and you gave a wonderful relevance along with illustrations. I think that was really scientific and very, very convincing. So thank you so much for doing this for us. Your talk was indeed impeccable, I would say. The magnetic resonance spectroscopy and the role of GABA in yoga, I think these were the 2 points I noted down to further dig in deep. And I would want to write to you maybe sometime and learn more about this, because these things are really helping us to understand more about it. And that is something on behalf of Rotary, we would like to spread amongst the community in addition to our physical community service. So once again, thank you so much on behalf of Rotary Bangalore Whitefield Central, Athashri and Rotary Bangalore Kalyan.
Club updates quickly.